Thank you, Mr Deputy Speaker. I'm sure my esteemed colleagues, including the Minister, will already have read my article concerning this important debate on the Politics Home website today. But I do understand the competition for time for parliamentarians, so I have brought with me a hard copy that I'm happy to share if anyone would like to read it. And for those more digitally minded, they can find it on the website. Mr Deputy Speaker, the mental health of thousands of children and young people has reached crisis point. And this week is Children's Mental Health Week, a week intended to shine a spotlight on the importance of children and young people's mental health. The Mental Health Foundation found that childhood determinants are the primary factor in future mental well-being, with over 3/4 of all mental health problems emerging by the age of 20. The government set out its ambition in the government's Mental Health Green Paper in 2017, but would the Minister agree with analysis by Barnardo's that the plans let down children and young people in 3/4 of England who will see no improvement by the end of 2022-23? I hope everyone in this room will agree with me that no child should have to reach crisis point to get help, but far too often we all know that is the case. A crisis can come in many forms. It can be seen in the criminal justice system, where a staggering 95% of 15 to 21-year-olds in custody have been found to suffer from a mental health disorder. It can be seen in the tripling in the number of young people under 18 with a recorded diagnosis attending A&E since 2010. And it can be seen in the 74% increase in suicide rates for 10 to 19-year-olds since 2010. And it can also be seen in local government association findings that social services were seeing more than 560 cases of children with mental health disorders every single day, an increase of more than 50% in 4 years.
I hope I'm not preempting what she's about to say, but does she feel that the explosion in social media and addiction to it by young people plays any part in this terrible increase that she's describing?
I thank my honourable friend for his intervention, and he makes that point very well. There's been a lot of research done by Royal Society for Public Health on this, and it's a contributing factor as there are so many. Thank you for his intervention. Looking after our children and young people requires children and young people's mental health services to be properly resourced. And at the moment, this is simply not happening. Almost a quarter of NHS child and adolescent mental health wards were rated as inadequate or requiring improvement by the CQC in 2019. And we also know that we have a huge shortage of mental health professionals, with a workforce that has hardly grown since 2010. According to the Royal College of Psychiatrists, we need an additional 4,370 consultant psychiatrists to meet the current government commitments. And a recent British Medical Association survey revealing that almost 2/3 of nurses said that on their last shift there was a shortage of one or more nursing staff. So can the Minister tell me how these shortages will be addressed?
Well, this is an absolutely superb German debate with a very, very critical issue. While there is an onus upon government to respond, and the Honourable Lady has referred to that, does she also recognise that the health charity place to be, and in the EDM 137 put before the House just this week by myself and others, that says that this year's theme is to find your brave. Does she understand, does she agree, I should say, that the schools, churches and voluntary sector youth organisations also provide help to children at a time that they also need it?
My honourable friend for his intervention, and he makes a really important point. Far too often we don't recognise actually the work that schools are doing, and especially the charity sector. They've contributed significantly, and it's unfortunate that the Green Paper doesn't actually recognise that. But today I want to focus on the public health approach, utilising early intervention and prevention. This is far too often overlooked, but is a vital part of any attempts to tackle the crisis we are facing. Furthermore, if we fail to support children at an early stage, then we will inevitably feel the impact further down the line when emergency services will be forced to step in. That is what we are seeing at the moment, and change clearly needs to happen. So what am I talking about, and what does it look like in practice? Let's take local government. Because of huge cuts by national government, 60% of local authority areas have seen a real-term spending drop on mental health services for children which come under the low-level bracket, which includes early intervention for things like eating disorders and depression. Or look at our creaking and failing criminal justice system. Research by Revolving Doors found that children of offenders are 3 times more likely to have mental health problems or to engage in antisocial behaviour than their peers. And as I said earlier, almost all 15 to 21-year-olds in custody suffer from a mental health disorder. Reducing reoffending and reducing the number of parents experiencing incarceration is not a good just in itself, but may also prevent their children from having mental health problems and reduce the likelihood that child is involved in offending in the future. So will the Minister explain why, in the answer to a written question last week to the Department for Health and Social Care, where they admitted that they had not made a formal assessment of the adequacy of mental health services or mental health assessment in young offender institutions, or take community-based mental health services? The Care Quality Commission, in their review of health care and adult social care in England 2018-19, found that 21% and 10% of community-based mental health services for children and young people are rated as requires improvement or inadequate for the responsive key question. Or schools. As my right honourable friend mentioned, schools in Birmingham are facing a funding shortfall of over £90 million in 2020. But they are still working hard to fund their own mental health support or arranging peer mentors. Why are they doing this? One of the reasons is that waiting times for referrals, if the referral is even granted, take far too long. Last year, I conducted a survey of schools in my constituency of Birmingham, Edgbaston, and discovered that 90% had seen an increase in staff and students suffering from mental health problems. This is not sustainable without a substantial increase in support for our schools. Or looked after children. According to government data, looked after children are nearly 5 times more likely to have a mental health disorder than their peers. Or poverty. The TUC found that poverty in working households increased by 800,000 since 2010. Poverty contributes to mental well-being. And the Centre for Mental Health Commission on Equality found that children from the poorest 20% of households are 4 times as likely to have serious mental health difficulties by the age of 11 compared to those from the wealthiest 20%.
Can I tell her that her speech is resonating with me, and the conversations I've had with teachers in primary schools who talk about the absolute stress that children as young as 6, 7 and 8 are under because their families are struggling to pay the rent despite the fact that they are at work. Poverty is a major driver to this. We have to be able to tackle both things, the mental health needs of our young people, but also the poverty under which they live.
I thank my honourable friend for her intervention, and she is absolutely right. Poverty does have consequences. And let's take social security. The government's flagship policy of universal credit is not only driving more households into poverty, but also creating a climate of fear and threats, all factors in leading to poor mental well-being. No child should have to reach crisis point before they're able to get help with their mental health. And we cannot pretend that the causes of mental health are simple or that they are not impacted and exacerbated by inequalities and injustice. The Centre for Mental Health have rightly raised the futility of funding mental health services that support symptoms if those resources are diverted from preventative measures to tackle poverty and inequality, which includes policies in the criminal justice system, education, public health, youth services, housing and social security. These sectors and services are all in vital need of long-term sustainable support, and that's why I'm calling on the Minister to ensure that a public health approach is introduced which promotes mental well-being, prevents future mental health problems and supports recovery from mental health issues. There are different ways to achieve this, but I would like to ask the Minister to take the first step and, with a reshuffle imminent, ask the Prime Minister to introduce a Children's Wellbeing Commissioner or similar with real teeth and powers and resources to work across departments. Thank you. I thank the Minister for giving way. Can she expand a little bit about how they're going to access that specialist support? Because early year counselling service in my constituency has a waiting list of 500 young people. It really does concern me because actually the only way that those young people are actually going to get any support is when there is a crisis that actually is happening. And I know she keeps referring to the money, but actually can she give us a bit more detail in terms of what people can actually expect on the ground?
Indeed, and I'm going to go on to access and waiting times. But what I would say to the the Honourable Lady is, one thing that she might want to go away and do is the money which has been given to care commissioning groups to spend on children and young people's mental health is actually ring-fenced. And what she may want to do is go back to her care commissioning group and ask to see the money they've been given by the government and ask how it's being spent, so that she can assure herself that the money we're providing to her care commissioning group is being spent on children and young people's mental health, and that it's not being siphoned off somewhere else. That's something I know that Claire Murdoch and the team at NHS England have been looking at care commissioning groups across the country where they think there are problems and mental health services are not being commissioned adequately, but she may want to go away and do that with her own care commissioning group herself and check that they are spending the money which is being given on children and young people's mental health.
Minister, for giving away. I think what my CCG will say is that the money is just not adequate. Birmingham is one of the youngest cities in the country. The issues are so prevalent in terms of across the city in terms of trying to access care. There just isn't the resources and the services, and we're not doing enough to engage our charity sector or support schools. I know that the government's announcement about providing counsellors in secondary, but what about early intervention? What about primary schools? What about when we understand those issues are manifesting themselves very early on? Why are we allowing it to just continue, and therefore we're having to spend money much more later on? It doesn't seem to make any sense.
Spend more money later.
Not. One of our announcements has been to launch the Trailblazer schemes, which we're hoping to have in 25% of schools by 2024. And actually speaking to a headmaster at a school recently in Birmingham, he told me that a third, and I do understand her problem in the area she's in, he told me that a third of the pupils in his school were receiving pastoral care or mental health care. And the reason why was because a third of those children came from chaotic homes where either one or both parents were addicted to either gambling, drugs or alcohol. And the consequences of that meant that they had serious problems with the children in that school, a third of the school roll.
I thank the Minister for giving way, but does she think it's right that we are going to be expecting teachers to take another role? There are already leads for safeguarding, for FGM, for prevent, a huge array of things. I mean, does she really think that that is right and that's actually going to address the issues?
Well, as I explained, we're putting Trailblazer, a fully qualified mental health, dedicated mental health workers into schools. And I would imagine, actually, that some of her schools in her constituency are going to be beneficiaries of that. So the responsibility isn't going to be with the teachers, it's going to be with the mental health workers. And I take her point, absolutely. Teachers do have a huge amount to do. But I will check with my officers whether or not any schools, well, which schools in the whole of the Birmingham area actually have Trailblazer schemes in, and when they're due to go in to help her be able to work with that going forward. But I'm quite sure she described her area as having 500 young people, that I'm sure they're very much on the list. I'll also check with Claire Murdoch at NHS England, who NHS England are responsible for delivering. And it's quite interesting because whenever I get constituents in my surgery and I say, well, actually, the government provides the money and we provide the policy, but NHS England are responsible for delivery, they say to me, who are NHS England? I don't know who they are. You're the government, but actually NHS England are responsible for the delivery. And so I will check with Claire Murdoch what's happening in her area and where the Trailblazer schemes are going.
Thank the Minister for giving way. I raised the point about inadequate care, and we know that the CQC has raised numerous concerns about mental health provision where young people are not getting the care that they need. What more? I mean, she's saying that it's NHS England's responsibility to really deliver on this. What more does she think she can do to put pressure on NHS England? What will we do? Because I don't understand how it's possible that if a care provision has been rated inadequate, how it can continue to provide care for other people. Who actually should then intervene if there isn't the changes, and if CQC have just left a young person in that provision to continue to get inadequate care?
Well, I'm not actually sure where the Honourable Lady is talking about. if she's talking about an inpatient unit, perhaps she'd like to speak to me afterwards about that and I can get more information for her rather than guessing. How we ensure NHS England deliver, I have regular meetings with both Claire Murdoch, in fact I've had one yesterday afternoon, Claire Murdoch and Tim Kendall, where we get updates about, Claire just a couple of weeks ago announced the launch of the first ever gambling clinic. So they are working very hard at NHS England to deliver the long-term plan. But as I've said, it is a long-term plan. The bath was empty, the plug's in, the tap's on, it's filling up. Claire is working her socks off, as is everybody else, to deliver as rapidly as they can. But the other side of the coin is the workforce, getting the mental health nurses in and trained, getting people through university where we're having more success, getting the people who want to attract people to work in mental health so that we can get those services. Claire is delivering those services as fast as she can, but they don't deliver themselves. They need people to deliver them, and that's what we're working very hard